Good morning, everyone, and welcome to the Ohio Children's Trust Fund's April Child Abuse Prevention Month webinar. My name is Nicole Silliman, and I am the Executive Director from the Ohio Children's Trust Fund. I'm excited to be here with you all and would like to express my appreciation that you've taken the time to join us today. I want to remind everyone that we will be hosting our final prevention webinar next Wednesday at 11 a.m. if you are interested in joining. And if so, please visit our website at octf.ohio.gov, and we will also provide the link in the chat. If you missed any of our webinars this month, you can view them on our website. Before we start today's presentation, I also want to review some housekeeping items. We kindly ask that you remain muted throughout the presentation. We will have time towards the end for questions, so please feel free to enter those in the chat. If it is a question we cannot address at this time, we will follow up after today's webinar. Also, this presentation will be recorded and uploaded onto our website for those who could not attend today. If you need a certificate of attendance, please indicate so via the chat with your full name and email address where the certificate should be sent. Please allow us a week or two to send these out depending on the number of requests we receive. I would now like to introduce our presenters, Ruth and Greg from Reach Out and Read. We are excited to have our presenters with us today, sharing their knowledge about the work of Reach Out and Read and everything that they're doing within Ohio as well as the United States. So with that, I will turn it over to Ruth to begin. Thank you all.
Thank you, Nicole. Thank you for this opportunity to be a part of this webinar. We're excited to be here. What you should expect today. Hold on, I think my slide. Can you guys see my slide? So I'm going to be here with my colleague, Dr. Zoomless, to talk about Reach Out and Read and our impact. And what you can expect today is I'll talk about who we are, what we're doing, and our impact. And Dr. Zoomless is going to give you guys a behind the scenes look of what actually happens during the well child visit. I call it magic. And then at the end of it, we're going to have questions and answers for you guys to ask us as well. I have Lori and Lynn, our program managers. They're currently in the chat. They'll be able to answer any questions that you may have in real time. And if they're not able to, we can do those at the end. So before we begin, I wanted to kind of paint a picture of Reach Out and Read and the work that we're doing. So imagine a mother named Maria living in a small apartment with her 2 young children. Every day, the stress of raising her children alone, struggling to make ends meet, weighs heavily on her. She's often overwhelmed, unsure of how to manage the daily challenges that come with parenting. One day, during a well child visit, Maria is introduced to Reach Out and Read. At first, she's unsure about the idea of reading to her child, especially with all the demands on her time. But the pediatrician encourages her and gives her the guidance on how to read to her children and gives her a book to take home and spend just a few minutes each day with her children. Over time, Maria begins to notice the change. Her children start looking forward to their story time, their bonds grow stronger, and so does her confidence as a mother. The stress of parenting doesn't go away, but through those moments of reading together, she begins to feel more connected to her children, more patient, and more equipped to handle the daily challenges. Maria's story is just one example of how Reach Out and Read is not just about books. It's about building relationships, providing parents with the tools to connect with their children, and offering support that strengthens the family unit. When parents like Maria feel empowered, it creates a protective environment that can prevent harmful behaviors, including child abuse. Today, I'll share with you how Reach Out and Read's approach is helping families just like Maria's, and how the simple act of reading together can help break the cycle of stress and prevent child abuse in our communities. So Reach Out and Read, our mission is pretty simple. We strengthen all families with young children through guidance from medical clinicians about nurturing relationships through shared reading. And we envision a world where every child has the relationships essential to learn and thrive. And how we do this is by partnering with medical clinics that provide services to children from under-resourced communities. Now, we know the problem, and Groundwork Ohio states that 60% of Ohio's children do not demonstrate kindergarten readiness, and only 43% of parents read to their babies daily. And studies also show that in 2021, 93, almost 94,000 total Ohio Children's Services reported screened in by the agency. And the types of reports were physical abuse, neglect, and sexual abuse. And we believe that Reach Out and Read Ohio is a part of the solution, and we're uniquely positioned to address the challenges faced by Ohio's children and families. And our evidence-based model and two-generational approach strengthen families through a variety of ways. One, it increases shared reading across parents. And we found that parents who receive Reach Out and Read are more likely to read daily to their children. It also significantly improves children's language development. And we've seen that language, it improves it by 3 to 6 months and higher receptive and expressive language scores, particularly when exposed to a higher doses of Reach Out and Read. And what that means is that they are part of Reach Out and Read from birth. We also have an unparalleled access via the pediatric primary care. Most of the children in the state through age 5 visit their provider annually. So in essence, we're meeting these families where they already are. And we have the potential to reach a large number of children as well. There's also mitigation of the effects of adverse childhood experiences. We know that positive experiences promoted through Reach Out and Read offers a simple yet effective strategy to facilitate a safe and supportive environment and is a buffer against the harmful aspects of ACEs. And Dr. Zumlis is going to talk a little bit more about that. And then ultimately, Reach Out and Read is a universal primary prevention model that promotes early relational health, and we're endorsed by the American Academy of Pediatrics. Now, you're probably wondering, well, what actually happens during the well child visit? And so during the well child visits, birth through 5, the Reach Out and Read trained medical providers, what they do is they talk to the parents about the benefit of reading aloud and encourage their young children and engage with their young children. They also encourage them to cuddle up and to read together at home and to build routines around books. They also show them how to look at books and talk about stories with their infants, toddlers, and preschoolers. They're actually helping providing the guidance and the coaching to give parents the confidence to know that they could do this. And then they give the child a new book that's appropriate to their development stage, and they get to take it home and they get to keep it and to start building their libraries. And also during this exam, providers also utilize the book as a tool for development surveillance and observe how the child and caregiver interact, and so that they're able to be proactive to see if there are any issues that are emerging and be able to coach and to provide the support that the families and the child need. Now, what are we doing in Ohio? Currently, we have over 337 well child visits, over 270,000 new books are distributed during that well child visit. We have 1,200 medical providers that really have taken this program and they do it with joy and they serve their families, serve the families that their patients. And then we also have over 196 program sites throughout the state. At this point, we're approximately serving almost 25% of the population birth through 5 in Ohio. And so just to kind of wrap it up for my portion, we're an evidence-based model, and the research has shown that parents are 2 times more likely to read to their infants and toddlers by being a part of Reach Out and Read. Also, as I pointed out earlier, children's language development is improved by 3 to 6 months, and children's language ability also improves with increased exposure to Reach Out and Read. There's also multiple benefits to Reach Out and Read's program. I call Reach Out and Read this potent pill that is able to address a lot of issues in one setting. And so some of those is that it enhances the components of the well child checkups. What it does is it increase well child checkup attendance. I spoke about that enhanced developmental surveillance because families are coming to those well child visits more frequently. We're able to be proactive between that clinician and that caregiver and that child around that child's development. Also, it improves the clinician relationships. It strengthens that and allows parents to be able to talk about some of the issues that's going on in the home. It also increases well-child checkup compliance. And lastly, it increases referrals to resources for families. During that well-child visit, the clinician and the patient and the caregiver, they're able to ascertain what are the issues that they're facing, those around social determinants of health, and then be able to provide those referrals and those resources to those families. So in essence, it's that one-stop shop that's able to provide and connect the resources within the community and wrap around these families to give them the extra support that they need. I'm now going to hand off to my colleague, Dr. Zumlis, and he's going to talk more about what happens during the well-child visit. And we also have a video and other things that we'd want to show you as well. So Dr. Zumlis?
So like we said, we've had a wonderful overview of the program, and I'm just going to talk about what actually happens in the room with Reach Out and Read, and also touch a little bit about those advantages that we've seen with Reach Out and Read that I see from the provider's point of view. So I've been practicing here at Cincinnati Children's for about 30 years, and actually been working with Reach Out and Read for 25 of those years. We started Reach Out and Read in 1998. And what I've really seen over the years I've really seen Reach Out and Read evolve and grow. And really the model and the message has stayed the same. You know, we talk about reading books, sharing books. Our message is that books build brains. But I think what I've seen over the years is that we've realized that it's a whole lot more than that. Like I say, I see it building relationships between clinicians and patients. I see using Reach Out and Read in the book as a tool in my visits more. And also I see relationship building between the patient and the caregiver. So I think what you'll see is that Reach Out and Read really isn't like a thing. It's just part of the culture of the clinics that take it on. And so really in the clinic, well, what do? First thing I do is I grab a book. And this is one of the very important things about the visit is that we always make sure that we grab the book before we go in the room. It's kind of like reviewing the chart, grabbing the book are very important. And the reason why we do this is because we want the book to be an integral part of the visit. We don't want it to be at the end of the visit after the family's been there and they've got their shots and the kid is crying. We go with the book and say like, oh, here's the book, make sure you read. No. We want to do it throughout the visit so we can really get the message across. And we also want to use the book as a tool. When I get to the room, it's the first thing I often use. I use it as an icebreaker very often. Like in this picture, you walk into the room and you see some apprehension, you offer the book and you start to talk about the book and, you know, it just brings things down a level and really helps us a lot. And as you'll see in the video in a little bit I'll talk about, we use the book actually as a screening tool for development and relationships. So like I said, when I'm ready to see a patient, I review the chart, I grab my book, I get all my tools, my book and my stethoscope, which are both very important, and I head to the room. And then during the visit, we talk about the importance of sharing books. And you know, I really talk a lot about sharing, not reading. Reading is great, but it's more important, you know, the words on the page aren't important. It's sharing that book and interacting over the book that is really the magic of reading with a child. So we make sure we leave that in the visit. And also we use the book as a tool to help model age-appropriate reading techniques, because certainly reading with a 6-month-old is very different than reading with a 4-year-old. So we kind of have that book in there so that we can show some of these things to the family. Right. And on the next slide, we have a little video. Unfortunately, I don't have a video of me. This is a 6-month-old visit, so we'll let this run and then we'll touch base when it's over.
Hi, hey you, what's going on? How are you? Yes. Oh, he's smiling now, cheesing. Hey, oh, you see how he reacts to my voice? He's responding to my voice. So they love to do a little table tennis. I talk, he talks, I talk. I'm sure he's battling with you now.
Always.
Are you screaming and yelling? And they love the 4 a.m. chatter.
Mhm.
Uh-huh.
He's just up. Okay.
You're just up and playing. So it's really important at this age that we're just talking and engaging with them as much as possible.
Right.
Lots of conversation is really going to be the best way for them to develop. So it's not only, yeah, what? Tell me.
He has a lot to tell.
I see. And you know Daddy's voice. So you see how he turns to you? So he's been hearing that voice since he's been in Mommy's belly.
Mhm.
And one day, before you know it, he'll be answering back. Yeah?
He answers back now.
Oh, you do?
He's not talkative right now.
Uh-huh. And you guys sing with him as well?
Sing, read at night.
Ooh, you like to read?
Mhm.
That's good. I have a brand new book for you here, man. Cody, check it out.
Baby
Wow. So we love the colors. Look at him reaching for it. Excellent. So at this age, they really love to touch. Gonna go right in the mouth. So it's all about touching and feeling. You see him responding to the colors. Hey. Oh, yeah. So, you know, it's not only hands and feet that go in the mouth, it's everything else as well.
You got
Look at
everything in
that. And we love to look at baby faces. Is that you? Yes. What's she doing? Is she taking a bath?
Yes.
Yeah, so you can name common items that are around the house, but you can also make up stories. So it's not really so much about the words in the book, it's the conversation that he's having with you. Yes.
Knows how the faucet is.
Oh.
Toothbrush, toothpaste. You see that?
You like to brush your teeth? Very
Very
good. Yeah, you like to look at yourself? Look at that. And you can kind of talk through it. Is this your nose? Is that her nose? Yeah. And her hands? Good job. So when do you typically read to him? Is it nap time, bedtime?
Mostly bedtime.
Okay.
Me and my wife, we take turns.
Excellent.
So like it'll be her night, then it's my night the next night.
Yes.
So it's been my night like 2 nights.
Uh-huh. Uh-oh. Mommy's turn. But that's good, because then he gets accustomed to reading with both of you.
His routine is like, okay, well, I'm reading, so I'm thinking it's time for me to go to sleep.
That's right. That's right. So it's a good trigger for him. And you can even do it sometimes during the day if you have time as well. It doesn't need to take a lot of time, just a few minutes, right? Just to build that comfort so that he learns to love books. So it's good to be so excited and exaggerated. Oh, look at the tree. And the tree's green. Look at that. So they really love to respond to our body language, you know? So the more we really are exaggerated, yes. And what else? We like animal sounds. What's your favorite animal? Do you like a lion? Rawr. Yeah, very good. I know. Yeah, let's see. You're okay. I'm right here. I'm right here. Let's see. Should we bring this book back in here? Here's your favorite. There you go. Look at that. You see how he calms when he's reading the book? Fantastic. Really important to wash. Yeah. Look at this color. You see this purple cabinet? Very good. Should we try and turn? He's doing awesome. You guys are doing wonderful with him.
So that was a 6-month visit. And I think you saw a really good example of reach out and read. So one of the important things I think is that the reach out and read isn't a separate thing. It's just integral to the whole visit. So it really happens throughout the whole well child. It's not like there's a well child and there's reach out and read and then there's the well child. It just all becomes one. And it gives us the chance using the book during the visit to continually deliver the message several times. You saw the physician talk about reading and how important the turns were, the back and forth with the family, not just once, but several times throughout the visit. And she actually kind of continued the guidance on through the physical exam. So like I said, it really continues throughout the visit. You saw her use the tool to kind of model some reading techniques for the parent and also kind of using the tool as a developmental assessment. They watched the baby grab it, put it into the mouth. They talked about how normal it was, how well that the baby was doing. And so this was a 6-month visit. So of course, reach out and read is going to look at a little bit different with different ages, of course, right? At, a 3-year-old, it's going to be a little bit different interaction with the book. We would talk about, having the 3-year-old helping turn the pages, you know, a little bit longer stories. But I think another important point that this physician made that we make with all families is that it should be fun. You know, reading isn't something that we're saying you have to sit down and read 20 minutes a day. I never tell parents how many minutes or anything. I just say do it. And like the doctor said, like a couple minutes at a time is fine. All of these moments are magic with the family, these back and forth, these warm moments over a book. So that's the whole message. Just, you know, read with your child, work it into the routine. Here they were already talking about bedtime. Some families do it when they wake up. Some families do it on the bus. So again, like having that book in the room for the whole visit gives you the opportunity to just not, you know, give a lecture about reading, is to interact with the book, talk about what the family's doing, and, you know, you really tailor your advice to the visit. And so now on to a little bit of, we talked about some of the benefits of Reach Out and Read, and I just wanted to talk about a few of them that I see that I think is really important in my practice. And the first one is that, you know, part of the big mission of Reach Out and Read is reaching the children who need it. And in our clinic and in a lot of the clinics in the Cincinnati area, we reach a lot of the children that are high risk for poor kindergarten readiness, children who live in under-resourced communities. Of course, we would love Reach Out and Read in every practice because there's need everywhere in every community. We all need to read more, but especially we're in the clinics that need it most. In the Cincinnati area, we have Reach Out and Read in all the federally qualified health centers. And, you know, all of these clinics are different. So we work really hard to serve the patient population there as best we can. We have books in over 26 languages. And we try to work to be part of the solution in the community, whatever the problems are, the barriers for families. Right. Next slide, please. Another big benefit that we see is that Reach Out and Read really helps clinic attendance. We found a twofold increase in the odds of parents reporting they've attended at least the recommended number of well child checks after we've Reach Out and Read. And parents really like getting information about development. So Reach Out and Read is a big part of that. All parents want to do good by their children. They want to know what they can do to help the development, and learning that reading and sharing books is something that's just not fun or something that you do, you know, it really helps the development. So, you know, our message that books build brains is great, but the more we see a child and we can deliver this message, the better. And I just think it's really important for children that are at risk, you know, to see them as often as we can. Every time a child walks into the clinic, that's another touch point where we have the opportunity to identify a barrier and perhaps help the family. If we've seen them, you know, once in the past year, it's a lot different versus I've seen them 2 or 3 times for their checkups. So every touch point is an important opportunity to really help families move beyond barriers, help them with the stress, and, you know, help them do well by their children, which is what they really want to do. Next slide, Ruth. And so I also feel that Reach Out and Read really enhances our developmental surveillance in the clinic. So it provides a dynamic way that we can really assess the development, which is something that we really want to do at every visit as part of all of our kind of standards of care. And as you saw in the visit, by giving the book to the child, you can assess motor skills, you can assess language, and it's a lot better. You know, every family who comes to our clinic does a million screen questionnaires on the tablet before I see them, right? And I'll look at that, and that's valuable information. But, you know, I can tell in 2 minutes watching a parent and child with a book a lot more than I can with all those questionnaires. And another thing with that is that if we're seeing the children more, we also have the chance to assess their development more. And, you know, early intervention and early referral is so important for children who are falling behind. You know, we don't want to wait until they get to school and they're behind. We want to get them into services if they need it at, you know, 4 months, 6 months, 9 months, as soon as we can. Next slide, Ruth. Reach Out and Read has been shown to improve patient-clinician relationships. And I think I see as this is one of the most valuable benefits of Reach Out and Read, and is really a big part of the magic that Ruth mentioned. You know, Reach Out and Read enhances clinic morale. Everybody loves it. It's something fun to do. You have books, and all the patients look forward to it. You know, families are more happy, clinicians are more happy. But what I think almost more is that I find is that interacting over that book really changes the dynamic in the room versus if I'm just going in, asking questions and giving advice. You know, how are things going at home? Are you doing okay with your housing, the rent? Are you stressed out? You know, parents always say, no, everything is fine. But sometimes, you know, I'll always ask questions, but then when we're interacting over the book, it can really bring out some other really important things that I can think really helps families and parents open up. And it's not like you're asking them questions and discussing certain things. You're just talking about reading, and all these things come out. For example, you know, I always talk about patients with families. They have the book. We talk about reading. Do you guys like to read at home? How often are you reading? And if they say no, we're not, that gives me the opportunity to ask more. You know, oh, well, tell me a little bit more about that. And a family may say, well, we used to read, but we lost all of our books when we were evicted. Or I am so stressed out with my job that we don't have time to read. You know, the last thing that I have time to do is spend time with my kids when I get home. And so it gives us a chance to really identify other factors in the family's life that are affecting, you know, not only reading, but their whole dynamic and development. You know, a parent may tell me like, oh, we don't read because he's so fussy. Every time I pick him up, he cries and cries and cries, and I can hardly stand it. Wow, that didn't come up before, but now here are important things that we can talk about the child's development and the stress of the family. The other thing that I think is really invaluable is not just my interaction with the parent or patient, but when I give that book to the child, what I see the caregiver do with the child is so important. You can tell right off if they take the book, they start to look at it, they have a really warm, loving interaction where they have, you know, a lot of turns back and forth, you know that the family is on the right track. But sometimes when the caregiver takes the book, you know, nothing happens. Like sometimes the mom is just really flat and quiet and can be really depressed, which hasn't come out yet. It opens the door for me to ask the parent more what's going on with them, what stressors they have in their life. And I just really find that parents open up to me a lot more than when I just ask questions, because we're talking more about, you know, reading in the book versus me just pinning the mom in the corner asking, you know, are you depressed? What's going on? So just interacting over the book is just a really wonderful magic kind of thing in the clinic. Next slide, Ruth. And so through Reach Out and Read, through all the visits, you know, what we really hope that we do is we develop these magic moments at home with the family, that the book becomes a really nice part of their day. You know, small moments when they can read the book at bedtime. It helps them have a routine no matter what's going on in their life. Some quality moments with the family, no matter what's going on. So, you know, over the years with more, research into adverse childhood experiences and ACEs, as we all know, we know that these moments are really important. Things like, you know, family time, family outing, family meals, playing with the peers, storytelling and singing, and really reading together. So I can really see that stress families like hang on to the reading. These are some magic moments that they have. So I think in the clinic through Reach Out and Read, we can help, you know, set the parents up for some really good quality time, no matter what's going on, you know, in the world. And we can also help with their interactions and their stress levels by identifying things when they're in clinic and helping connect with resources. And next slide, Ruth. And I just wanted to say a few words. I am really lucky here in Cincinnati. I work with the Reach Out and Read program and also Dolly Parton's Imagination Library, which you may have heard about. The Imagination Library, thanks to the efforts of Fran DeWine, is available to every county in Ohio. Every child under the age of 5 is eligible to enroll for free books mailed to the home once a month until the age of 5, which is a wonderful resource for parents. And I only mention it because sometimes when I do talks, I get comments like, well, what do you do? Do you do Reach Out and Read or the Imagination Library? And to me, that just like blows my mind because they are both so important, but they are so different, right? The Imagination Library is sending a resource for to the home for a parent to use. More books equal more reading, we know that. But Reach Out and Read is more based in the practice, and we're really talking about the reading and making sure that the parents are using the book. So in our clinic, Imagination Library is part of the Reach Out and Read visit. We talk about reading, and every time they're there, we check and make sure that they're enrolled with the Imagination Library. They're still enrolled, they're getting their books, but they are both very important but very different programs. Now I will hand it back to my colleague Ruth.
Thanks, Dr. Zoomless. And what I wanted to do is just kind of highlight that not only what happens in the clinic and the supports that we provide to the clinical sites and the families, we also want to integrate ourselves in the larger ecosystem that serves these young children and families. And so we've had partnerships throughout the state, partnership with Pre4Cleve, where we saw over 50% of referrals from targeted Cleveland neighborhoods indicated that they were referred by their child's doctors. You hear, here's a quote by the director that says that the fact that the people are actually calling demonstrates the success. We don't often know how people learn about Starting Point, and this we do. Also just highlighting the relationship, the partnership with DPIL in Cincinnati that Dr. Zoomless just articulated, and seeing record signups and numbers due to the clinics fully engaged in signing up to children and families. And then hospital records were used to find families when a book was undeliverable. And then just lastly, library systems. We're partnering with various library systems statewide. And our hope is to expand our partnerships because we know that no one organization can do it alone. One of the things that Reach Out and Read does offer is this unparalleled access to 90% of birth through 5 children in the state. And we want to be able to leverage that and partner with other organizations that are wanting to see these children get off to the best start in learning and in life. And I just wanted to kind of wrap up our presentation. You know, here at Reach Out and Read Ohio, we have this ambitious goal to reach 50% of Ohio's children by 2030, where we aim to create a world where every family uses shared reading to build the bonds needed for their children's health and future. I'll wrap it up by saying this. There's a quote by Desmond Tutu that I love, and it says that at some point you have to stop pulling people out the river and go upstream to find out why they're falling in. And I believe that this work that we're all doing is that sacred walk of going up that stream and equipping our these parents and these children with the tools that they need to give their children the best start in learning in life and be able to have those positive interactions that will help mitigate some of the things that we know life will throw at them. So thank you for this time and for this opportunity. We're going to now pivot to a Q&A. Any questions that you have? I have not been looking at the chat because I can't look at the chat and look at the screen at the same time, but I'll stop screen sharing and we'll answer any questions. But here's our contact information. My email's is up there. Dr. Zoomless and the great work that he's doing at Cincinnati. And then our program managers, Lori and Lynn, who have been monitoring the chat, will be able to answer any questions that you have. So I'm gonna stop sharing and then I'll just kick it off to Nicole. Did you want us to just go ahead with questions and answers of the Q&A session?
Yes, and I don't necessarily see any questions. So folks are welcome to go off mute and ask their questions if they have any in real time as well.
All right, I see Mark, you have a question?
Mark, are you on mute?
Mm-hmm. Okay, that happens on Zoom. Trying to get off the mute button can be difficult sometimes.
Here, unmute. Okay.
All right, can you hear us now?
Mm-hmm.
Okay.
Okay, so I'm here, Andrea, his wife. So couple questions. I've never heard of this imagination library. So this is just something, I don't know if you could just give a little more detail about that.
Greg, I'm gonna hand this off to you.
The Imagination Library was funded by Dolly Parton in her hometown some while back. Now it's available to anybody in the country where there's a program. So there's a statewide program in Ohio, actually Kentucky and Indiana as well. And so basically anyone from birth to age 5 can sign up to receive a free book mailed to their home once a month until the age of 5. And the books vary by children age. So it's building the home library at home.
Okay,
We're on the website right now for Ohio. Reach out and read, and obviously it's real good about what they do, why they matter, get involved. How do you register a child or a family who could benefit and be available for this service?
Reach out and read. It will depend on the clinic that they go to. So Imagination Library sends books to the home, so anybody can enroll for that. Reach out and read will happen with children who attend a clinic who participate in the program. So that's more of depends on where children get their primary care.
okay. So other question, I know you said it doesn't matter how, it's not a matter of how many minutes you read to them, but doing it every day type thing. What's the situation with kids who are, pretty severely autistic? Is there a different answer?
I think any interaction is good. It's more about, those interactive moments. So if a child is developmentally delayed or neuroatypical like autism, reading the book may look a lot different. They may not sit for a story and read the words. They may want to just look at the pictures with the parent, or they may just want to flip through the pages with the parent. It's whatever captures that child and, helps the parent and child have an interaction over the book. So reading and sharing books can look like a lot of different things depending on the developmental age of the child and any other factors.
Okay, thank you. That helps a lot.
Did you get your question answered about this?
Mhm.
There's a few things in the chat where there is no registration for Reach Out and Read. If you do want to be able to find where find a site in your area that does Reach Out and Read, the link is in the chat where you can do that and be able to find that. Emily asked, is there any concern about funding for Reach Out and Read? I'm a pediatrician at a health department in Cincinnati, and giving out books is important for the work I do. That's something kind of. Greg, did you want to answer that since that's well, no. Each clinic funds their books different. One of the things about Reach Out and Read, the affiliate, and why we're here is to help partner with those clinics to raise funds to be able to provide books, particularly for clinics that are in those under-resourced areas. And so you can definitely take our information and we can follow up with you to just get a little bit more detail about what that entails. But that's usually what the process is. And Lynn says, Emily, let's talk. I'll contact you. Any other questions? All right, it seems like there aren't any questions. So Nicole, I'm just going to hand it off to you. Thank you guys so much for this opportunity. You have our information. If there's any questions that emerges after, you feel free to reach out to us As Nicole stated, this is being recorded and I think it'll be sent out to everybody as well. So thank you for the work that you all do. You truly are the heroes, and we're just glad to be in this work with you all. Thank you.
Yep, and thank you to our presenters today. This was really informative, and we will send out the slides after the fact. So if you do want to send them an email and reach out for any questions, you will have their contact information. But we appreciate everybody joining us today, and then thank you for the questions and the thoughtful discussion. And we hope you all have a great rest of your Wednesday.